Dear colleagues, firstly, I would like to thank the organizer of the conference, U.S. Chamber, for the opportunity to take part in this conference. The topic of my today's report is sleep and longevity. This topic is quite extensive, but my report will briefly focus on the following issues: key modulators, sleep homeostasis, oxidative stress, changes in sleep architecture and patterns in the elderly, factors influencing the regularity and duration on sleep in elderly, sleep and cognitive reserve, intermittent hypoxia, a role of cognitive disturbances, cardiovascular diseases, and metabolic syndrome, hormetic nutrition and sleep relevance to sleep disorders, health, longevity, life, and approach to maintain healthy sleep in advanced age. On this slide presents a model of homeostasis. The concept of homeostasis is being increasingly appreciated in all situations involving everyday life. On one hand, when exposed to small doses of stress factors, there is an increase in the transcription factors. They activate vitagens and hemoxidinate heat shock protein 17, thyrodoxine, citrulline 1, gamma glutamate cysteine synthetase, and which contribute to longevity. On the other hand, when exposed to high excessive doses of stress factors, oxidative stress is triggered under the influence of exogenous and endogenous factors with the release free radicals, reactive oxygen species, and reactive nitrogen species, with detrimental consequences for physiology and health, leading to various diseases. Everyone knows the phrase by Friedrich Nietzsche, "What doesn't kill me makes me stronger." In this article, Martin Hucker with colleagues consider the hypothesis deprivation of sleep could benefit humans. Using the homeostasis model as an example, in somnology, the main stress factor can be deprivation or lack of sleep. That is a single sleep deprivation, as the authors believe can lead to positive result. But it has long been known, and there are many experimental and clinical studies that long-term deprivation leads to various adverse health effects. This model shows that various dimensions of sleep-wake function can affect distal outcomes on health and function. Intermediate processes may include epigenetic, molecular, and cellular processes that in turn affect system-level processes. This model also recognizes that the relationships between sleep-awake functions and molecular and cellular systems and organism-level outcomes are reciprocal, just as sleep affects function and health, so function and health influence sleep-wake function. The sleep-wake cycle is controlled and balanced by two internal processes. The circadian rhythm at the homeostatic drive, whose activity decreases with age. This picture shows the related changes in the sleep architecture in the elderly. With age, a decrease in the following sleep parameters is more often observed: percent slow wave sleep, percent rapid eye movement sleep, and an increased sleep latency and wake after sleep. This slide presents factors affecting the regularity and duration of sleep, which include the first group, directly sleep disorders, represents the current classification and main group of sleep disorders, third edition. The second group present various comorbid disturbances, and the third group present environmental conditions. The importance of sleep regularity and duration is actively debated in the literature. This slide presents the late prospective cohort study. Sleep regularity is a strict predictor of risk of death more than sleep duration. The authors used objective sleep measures from a large cohort, more 60,000 patients, and 10 million actigraphies were performed. The authors also found that people with irregular sleep patterns had a higher risk of mortality, and that sleep regularity or stronger predictor of mortality risk than sleep duration. Regular sleep may improve health and survival. Another later study examined the association of accelerometry measures sleep duration with incident cardiovascular disease and cardiovascular mortality. More than 19,000 patients were examined. A total more 13,000 participants developed cardiovascular diseases, and more than 1,000 participants died of cardiovascular diseases. Compared with sleep duration, 7 to 9 hours per day, the accelerometry measured sleep duration less than 7 hours per day, associated with higher risk of incidence cardiovascular disorders related mortality. In a recent study, the epidemiology of sleep disorders in Israel, the authors examined nearly 200,000 people. Prevalence of sleep disorders increased with age. 5.2% in young adults and 22.3% among seniors aged 75 and older. The most two prevalent disorders were insomnia, about 7%, and sleep-related breathing disorders, 2%. The authors concluded the overall prevalence of sleep disorders included insomnia and sleep-related breathing disorders in Israel were similar to other Western countries despite stressful life events of ongoing war and terrorism. On the relationship between sleep disorders and their impact of cognitive function is being studied actively. This figure demonstrates the results of recent review in which the authors summarize existing research examining interaction between the role of cognitive reserve, sleep alteration, and cognitive function. The gray arrow suggests a lack of research investigating the role of cognitive reserve and protective or enhancing factor on sleep. The green arrow represents the promotion effects of sleep on cognitive reserve, as well as the protective and ameliorative moderating effect of cognitive reserve on the relationship between sleep alteration and cognitive function. The red arrow shows the terminal effects of sleep alteration or cognitive function. This slide demonstrates the impact of obstructive sleep apnea. This slide presents a possible model or relationship between sleep disorders, breathing disorders during sleep and during function in the elderly, as well as a potential mechanism of disorders occurring during intermittent hypoxia that have a negative impact to cognitive function. Intermittent hypoxia leads to sleep disorders causing insomnia and severe sleep and cognitive dysfunction as consequences lead to various negative physiological and social effects. This slide demonstrates the impact of obstructive sleep apnea upon vascular regulation depending on its severity. This issue is being actively studied in experimental models and clinical studies. With increasing age, the severity of hypopnea syndrome increases, which thereby increases the number of cardiovascular disorders. This slide shows a model of potential mechanism linking sleep apnea and diseases of carbohydrate metabolism. Intermittent hypoxia in sleep apnea triggers hypothalamic pituitary adrenal axis dysfunction with all further reactions Sleep fragmentation and restriction increases systemic markers of inflammation as well, followed by a cascade of biological reaction. All this leads to insulin resistance and impairment, glucose tolerance, and development type 2 diabetes. I would like to note that there are many clinical studies indicating that the administration of continuous positive air pressure in apnea-hypopnea syndrome significantly reduces the severity of the syndrome apnea-hypopnea in patients with cardiovascular diseases and carbohydrate metabolism disorders. In recent years, the use role of polyphenols such as resveratrol, rosmarinic acid, chlorogenic acid, catechin, sulforaphane, curcumin, and other has been actively studied in various diseases. There are also studies examining the effect in polyphenols for improving sleep and sleep disorders. According to the available data, it can be noted that polyphenols might be efficacious adjuvant therapy for decreased odds on sleep disorders. The beneficial effect of polyphenols also depend on the treatment duration, and further experimental and clinical study are needed to study polyphenols on sleep and explain their mechanism on action and improving sleep. When studying the protective role of neurotrophic growth factor on cognitive impairment in conditions in chronic intermittent hypoxia and sleep fragmentation in mice, it was found that sulforaphane nuclear factor erythroid agonist elevates cognitive impairment induced by chronic intermittent hypoxia and sleep fragmentation by modulation and endoplasmic reticulum stress. This slide shows the results of research study that showed the protective effect of resveratrol in chronic intermittent hypoxia lasting for 6 weeks. The authors found that resveratrol ameliorates intermittent hypoxia-induced spatial memory deficit in young rats. Resveratrol attenuates intermittent hypoxia-induced expression of P47 FOX subunit of nicotinamide adenine nucleotide phosphatase oxidase. Therapeutic role of dietary polyphenols as essential regulation contribute to development of new therapeutic strategies capable of suppressing oxidative stress, neuroinflammation, intermittent hypoxia, and beneficial effects on cognitive function, metabolic syndrome, and cardiovascular diseases. Existing relationship of sleep with a different disease, metabolic, cardiovascular, and other diseases, ensuring healthy sleep and improving the quality of life during aging is an important issue, since age-related pathologies have a significantly increasingly impact of health system. Poor sleep and sleep disorders shouldn't be considered an inventable part of aging process. Back in 1990s, a model of healthy sleep in advanced age was proposed. This model is useful for regulation of sleep in elderly and focuses on the processes of adaptation and successful age, and also consists 3 key behavioral components: selection, optimization, and compensatory strategies. Can lead to a reduction in different disorders and may promote longevity. And conclusion, the role of sleep in achieving longevity can't be overestimated. Early diagnosis and treatment of sleep disorders and respiratory sleep disturbance, quality sleep, can lead to a reduction cardiovascular disorders and may promote longevity. Sleep, of course, isn't an isolated factor in promotion of long and healthy life, but rather it is an essential element of balanced lifestyle, what depends on different factors. quantity and quality of sleep, cognitive and behavioral function, nutrition support, physical activity, various comorbidity diseases, social interaction. I would like to end my report with a phrase, sleeping enough is our way to better health and longevity. And I'd like to finish my presentation saying thank you, Professor Calabresi, Vittorio Calabresi, University Catania, for helpful suggestion. Thank you very much for attention.
Thank you very much. I think sleep is extremely important. Just want to mention that in the cardiovascular preventive, that they say 150 minutes of activity and Mediterranean food and all of that, they just 2 years ago added 7 hours sleep to prevent for cardiovascular. So sleep is extremely important, and I really love your talk.